Okay, wow. You guys have really given us a challenge this time, sending in all this medical info about an ICU patient.
Yeah, it looks like we have a real medical mystery on our hands.
For sure. We're talking about a 58-year-old man, 6 days in the ICU already, battling some seriously severe sepsis. And it looks like it all started with pneumonia. He's intubated, on the ventilator,
Yeah.
and to make things even more complicated, he has a history of hypertension, type 2 diabetes,
Oh, wow.
and chronic kidney disease.
Sounds like his body's already been through a lot.
Definitely. And then on day 6, things really went downhill. Fever spiked, blood pressure plummeted even with fluids, heart rate's through the roof.
Uh-oh.
And to add to all that, his abdomen's all distended and tender in that upper right quadrant.
Not good.
And the blood work, not looking great either. High white blood cell count, liver enzymes are up, bilirubin's high too, and then the kicker, an abdominal CT scan.
I bet that's going to be key.
Right. Sadly, we don't have the images, but I'm guessing the results are going to be pretty important. So based on what we know so far, what are you thinking?
Well, just from that fever, the low blood pressure, the rapid heart rate, that just screams sepsis, which, is that whole body life-threatening response to an infection. It's actually becoming more and more common, and sadly, it has a high mortality rate, especially when the patient's already dealing with these other health issues.
Yeah, it's pretty scary stuff. So how do the abdominal issues and the liver tests, how do they fit into all of this?
Great question. So the abdominal problems, that tenderness specifically in the right upper quadrant, and those liver test results, they're all kind of pointing towards a potential gallbladder issue. It's very possible he's developed acute cholecystitis, which is just inflammation of the gallbladder and a known complication of sepsis.
So the pneumonia might have set off this whole chain reaction leading to sepsis, and now we're possibly dealing with a gallbladder problem on top of everything else.
You got it. And that's where the CT scan comes in, super important for confirming or ruling out that cholecystitis or any other problems in the abdomen. It'll help the medical team figure out what to do and how urgently.
Looking at the information you sent over, there are a bunch of potential management options here. What are we looking at?
Yeah, so we have option A, which is basically continued supportive care, monitoring the patient really closely, managing their symptoms. It's the standard approach, but in a severe case like this, might not be enough.
Right, so what else is there?
Well, option B is broad-spectrum antibiotics, which are absolutely crucial for fighting sepsis. But antibiotics alone might not fix that underlying problem with the gallbladder.
So they're necessary, but maybe not sufficient. What about option C, the ERCP? I think a lot of our listeners might not be familiar with that one. What does that actually involve?
So ERCP, that stands for endoscopic retrograde cholangiopancreatography. It's a procedure where they use a thin, flexible tube with a camera on the end to look at the bile and pancreatic ducts. Helps them identify any blockages or anything else causing problems with the gallbladder. But, like any invasive procedure, it does come with some risks.
Right. Makes sense. And then we have options D and E, which both involve surgery on the gallbladder.
Exactly. Option D is elective cholecystectomy, which is basically just surgically removing the gallbladder. And then option E is a percutaneous cholecystostomy. It's less invasive. They drain the gallbladder using a needle through the skin. The choice between those two really depends on how stable the patient is and how severe the cholecystitis is.
And then there's option F, which is just IV fluids and pain meds.
In a case this complex with the possible sepsis and gallbladder issues, option F probably wouldn't be enough on its own.
Seems like everything really hinges on the results of that abdominal CT scan then.
Absolutely. Those findings will give us a way clearer picture of what's happening in there and really guide the treatment plan. It could be the deciding factor between just watching and waiting or immediate intervention.
This has been an incredible deep dive. We started with this patient fighting severe sepsis from pneumonia, and now we're looking at potential gallbladder complications and all these treatment options. It really goes to show everything in the body is connected and how one problem can snowball into something much bigger.
You said it. It really highlights the importance of looking at the whole picture in medicine. You can't just treat the symptoms in isolation.
Exactly. And before we wrap things up, I want to leave everyone with something to think about beyond the medical findings we talked about. What other factors might influence the medical team's decision-making in a case like this?
Ooh, that's a good one. It really comes down to things like the patient's overall health, what they want, the potential long-term consequences of each treatment option, and even just the resources available at the hospital. All those things play a role in the final decision.
It's true. This whole case really shows how complex medicine can be. and the tough decisions healthcare providers have to make every single day. Hopefully this deep dive has given you a better understanding of sepsis, critical care, and how important diagnosis and treatment are. Keep exploring, keep learning, and we'll see you on the next deep dive.
Absolutely. See you then.